Good morning to you, friends. We are cutting into your normal programming here on NBC Local 33 and Fox 44 as we are expecting to hear any minute now from Governor John Bel Edwards and U.S. Surgeon General Vice Admiral Jerome Adams as the state is now under a public health emergency due to the coronavirus pandemic.
According to the State Department of Health, Louisiana now has another case of the coronavirus, this time Orleans Parish getting another one. That brings the total number of presumptive positive cases to 14. Let's listen in live now to Governor Edwards.
From here in Louisiana who were able to spend some time with him, and I appreciate him for taking the time to sit down with us to discuss COVID-19, our response in Louisiana, lessons learned from other states, what they're doing at the federal government. The more communication, obviously, the better. And I also want to thank the many federal officials who've had conversations with us and with me in particular over the last several days, especially Vice President Mike Pence. He has held a number of informative briefings with governors. I have been able to speak with members of the task force that he has assembled, including Brett Giroir, who works at Health and Human Services as the Deputy Secretary? Assistant Secretary. And he's actually a Louisiana native. Federal support is always important, but especially in times like this, and we've had very good access to information from federal experts. We just finished a good discussion, as I mentioned, with local leaders and healthcare stakeholders. And so for the next few minutes, I'm going to turn the podium over to Vice Admiral Adams, who will make some additional remarks. And then we will come back. I will come back at the conclusion of his remarks, finish my prepared remarks, and then we will take your questions. So Vice Admiral Adams.
Thank you. Thank you. Well, good morning, everyone. Thank you so much for coming out. We really are at an inflection point, I think, in terms of the way we think about and respond to the novel coronavirus. I want to thank you, Governor, for your leadership. As he mentioned, we had a fantastic meeting with local leaders, with leaders from the parishes, leaders from the local health care communities, nursing homes, and beyond. And I learned a lot. I think I imparted some knowledge to them that they may not have known about the federal response, and at the end of the day, that's how we're going to get through this, with federal, state, and most importantly, local interaction and engagement. I want to go through a really brief Coronavirus 101. This is a novel virus with many unknowns. It's important for folks to know that. Things are changing each and every day, and we are trying to rapidly evolve our response to what we are learning both abroad and here in the United States. But that said, this isn't our first rodeo. We've dealt with H1N1. We've dealt with MERS. We've dealt with SARS. Communities have pandemic response plans that they have gone over, practiced, and are implementing right now. Also important to know that the novel coronavirus is actually from a family of viruses that include the common cold and MERS and SARS. So there are things that we do know about how to respond to it. The novel coronavirus started in China, and it causes a mild flu-like illness in most people. 80% of people who actually get the coronavirus, and probably more than that because so many folks are asymptomatic, but 80% of people do not need medical attention. Important for people to know that. Most people who get this virus by far will not need medical attention, will actually be fine. And one of the things I've really tried to lean into is what we've learned about this virus is that it actually really has a very unique way that it affects different age groups. We know that people with chronic medical conditions over the age of 60 are most likely to need medical attention. We know that people with chronic medical conditions over the age of 80 are those who are most likely to die. But interestingly enough, young adults and children, if they get the coronavirus, their mortality rate is lower than if they got the flu. I'm going to say that again. If you are a child or young adult, you are more likely to die if you get the flu than if you get the novel coronavirus. And so a lot of our attention is really focused on protecting those who are most vulnerable and those who are most at risk. And as I shared with folks earlier, it's why we see such differential play out in South Korea versus in Italy. South Korea, the majority of people who got the coronavirus were younger. And so they had a very low mortality rate. In Italy, the majority of people who got the coronavirus were older. And that's why you're seeing such a high mortality rate there. And that's why some of the things the governor is going to be talking about in a little bit really are geared towards protecting the older populations with chronic medical conditions, those who are most vulnerable. Last night, you all may have heard there was an announcement last night. The president told the country that we're going to have a 30-day restriction on foreign visitors from most of Europe. This does not apply to U.S. citizens. Why are we doing that? Well, the epicenter of the coronavirus used to be in China. 98% plus cases used to come from China. Now, Europe is the new China. And very specifically, Italy is the new China. And so we want folks to know that in 30 of 35 states in the United States where we've seen spread of coronavirus, the majority of those cases can be traced back to people who came in from Europe. And it's why the president took bold and aggressive action, really unprecedented action, in stating last night that we will be limiting for 30 days foreign visitors from most of Europe. Americans that return will be screened through airports and instructed to self-quarantine. So again, this does not apply to Americans. We are not saying Americans cannot come back to this country. We want to make sure when they do come back, they self-quarantine. Really quickly, I want to wrap up so we can hear what the governor's working on in Louisiana. But it's important to understand we are shifting from a containment posture to a mitigation posture in regards to our coronavirus response. What does that mean? Containment is when you know where the cases are coming from, and it's outward facing. It's saying we're going to keep those cases out of our community. We knew most of the cases originally were coming from China, and so we had travel restrictions from China, and all the scientific evidence says that that definitely did delay the spread of coronavirus to the United States. But then you started to see cases pop up all over Europe, and they started to seed the United States. So now we're shifting to a mitigation posture. Mitigation is inward facing. It's saying we've got coronavirus in our communities. What can we do to lower the impact of it, to slow the spread of it? And the governor and I have talked a lot this morning about flattening the curve. You may have heard about that. Flattening the curve is really an idea from public health that is really all about making sure we don't overwhelm our healthcare system. It's about spreading out the cases by doing what we call non-pharmaceutical interventions, things at the individual, at the community, and at the environmental level that will protect people. And really quickly, those things include frequent hand washing for 20 seconds with soap and water. Hand sanitizer is an appropriate number 2, but hand sanitizer, I've heard, is going for quite a bit on eBay and on Craigslist right now. So important for people to know that soap and water is cheaper and better than hand sanitizer. And if you need some soap, just let the governor know, he'll get you some. But hand washing, covering your cough or sneeze with a tissue and throwing it away, very important to do. Staying away from people who are sick, frequently cleaning surfaces, individual things. Community things you can do. Social distancing, making sure you're limiting large gatherings, contemplating, and we talk with the parish leaders about this, closures. And I hope you all get a chance to ask the parish leaders some questions, but we have to be really careful when we're talking about closures, because if you close a school, you've got to have a plan in place for where do the kids go and who's going to watch those kids. So we want the communities out there to understand that you have to bring in the businesses, you have to bring in schools, you've got to bring in caregivers and say, okay, what's the best plan to protect our community? And then environmental non-pharmaceutical interventions like cleaning surfaces. We talked a lot about testing, and we've got the state here who can tell you what's going on here, but I felt very reassured by what I heard from the State Department of Health here in Louisiana about the availability of testing. Important for people to know that not everyone should be getting a test right now. If you talk to your healthcare provider, that's a conversation that you need to have about whether or not your risk is high, whether or not it's going to change your outcome, and whether or not it is appropriate for us to utilize limited resources to test you versus to test someone else who may be at much higher risk. But we have testing capacity at the state level, testing capacity at the CDC, and testing capacity is quickly ramping up within the private industry. I want to finish by saying now's the time when we can have the most impact to get people to take precautions. But we have to help people understand preparing doesn't mean panicking. I tell people 3 things. Number 1, know your risk. Know if you fit into one of those high-risk groups, a person with chronic diseases, especially people who are older. Number 2, understand your circumstances. Am I planning on going to a basketball game? Am I planning on going to church? Am I planning on going on vacation? So that you can look at your risk and put it in perspective in relation to the circumstances you're going to be involved in. And then number 3, know how to protect yourself. And the most important thing I can tell you in terms of knowing how to protect yourself is to go to coronavirus.gov. This is the federal website that's designed to answer all your questions on coronavirus, and it has advice for specific audiences, for faith organizations, for employers, for schools, and for communities and individuals. So coronavirus.gov. And again, Governor, thank you so much for your leadership. Thank you to all the healthcare leaders and the parish leaders who are here today representing the people of Louisiana. I am confident, I leave the meeting we had this morning confident that you all are taking the appropriate steps to really mitigate the impact of coronavirus here in Louisiana and to flatten the curve.
Thank you, Vice Admiral Adams. Thank you, Vice Admiral Adams. Again, we appreciate you being here and sharing your thoughts with us this morning. As you all are aware, yesterday I declared a public health emergency for the state of Louisiana. The declaration that I signed ensures that state resources are made available to our state agencies and local governments. It also addresses several issues related to price gouging, should that become necessary, as well as prohibiting international travel for state employees to level 2 and level 3 countries that are designated as such by the CDC. These guidelines were developed by the COVID-19 task force that we stood up several weeks ago. As of this morning, and this is an update for you all if you don't have it, we have 14 presumptive positive cases in Louisiana. That is one more than we shared with you yesterday afternoon. That is one more from Lambeth House has tested positive. So we now have residents from the following parishes: Orleans, Jefferson, Lafourche, and Caddo. And I think I want to revisit just for a moment presumptive positive, because I want to make sure we're clearly communicating. We have extreme confidence in the accuracy of these tests. We are treating these as if they are positive. The way this works, the CDC will confirm positive tests. That hasn't yet happened. But we have confidence to a very high degree that these are actual positive cases here in Louisiana. As I mentioned yesterday, we now have community spread in the Orleans area in at least one cluster. And that sort of reinforces what I believe the Surgeon General was relating to us this morning. We're at an inflection point here, just like the country is, more or less. Yesterday, we reported a presumptive positive coronavirus result of an Iberia Parish resident. That was based on information provided to the Office of Public Health by the patient's health care provider. That was actually inaccurate. That individual was a resident of Lafourche Parish. So we were operating with the information we had yesterday. I apologize. We correct that now. We don't have anyone from Iberia Parish, but that individual is from Lafourche Parish. Additional investigation revealed that the patient, as I just mentioned, lives in currently in Lafourche Parish and is hospitalized in Lafourche Parish. And so we've updated our reporting list to indicate that that case in Lafourche. I want to make sure that everyone, because we say it so often, and what we're saying is of a nature that I think people sometimes don't take these things seriously. Public health and safety is the #1 priority of the federal government. It's the #1 priority of the state government. It's the #1 priority of the local government. I want to thank these 2 parish presidents for being here. What we have to do to protect public health more than anything else is lower the peak so that we don't have more cases than is necessary, and then extend the duration so that we don't put too much demand on our health care providers in certain areas all at one time. And it gets back to doing very simple things that are most effective that we can do. And those are the non-pharmaceutical interventions that he just mentioned, because we are now in a mitigation role. We're trying to lower that peak, flatten the curve, limit the number of people who become infected. We're doing that also through contact tracing, and we're going to continue to gather information about this and all of the current presumptive positive cases so that we can monitor close contacts to prevent the spread of illness. Testing has ramped up in Louisiana. As a result, and no one should think otherwise, we are going to see more positive cases in Louisiana. That is going to happen. LDH began updating presumptive positives and other relevant information twice daily at 9 a.m. and 4:30 p.m. online at ldh.la.gov/coronavirus. Again, that's ldh.la.gov/coronavirus. As more cases are deemed positive, we need people to stay calm, obviously, take appropriate precautions, and closely follow the information being put out by officials and the Louisiana Department of Health. And I'm going to go back through these again, and I know the Surgeon General just did this. These include frequent hand washing, avoiding close contact with others, covering your cough with the crook of your arm, and staying home if you are sick. Yeah, thank you very much. And we know that those who are elderly and those with chronic health issues are at the greatest risk. So on the one hand, the good news is that the younger people don't seem to be as affected by this. The problem there is that they can have it, may not even know it because they're mildly symptomatic, but they can transmit it to someone who is in the at-risk population. And so that's why we need people to wash their hands and take these basic precautions. We owe it to our loved ones, to those who are older, to those with these chronic underlying conditions, to make sure that we do everything we can not to infect them, because we know that they are the most susceptible to having the worst outcomes. And that's why it's so important that we do these things, and we can't say them enough. Again, it's common sense things that we have to do, and because they're so common sense, people think that they're not important. It is the single most important set of things that we can ask people to do. And so these people behind me, they're going to do everything they can all across the state of Louisiana to take care of people, prevent the spread, and make sure that we get through this with the best possible results. But everybody in Louisiana has a role to play. Everybody in Louisiana has a role to play. And now that certain things have happened, we actually have elevated in the consciousness of people this coronavirus situation. I think I'm not going to speak for the Surgeon General, but I think I probably could do a press conference once a day and talk about this and implore people to do what we're asking them to do, and it wouldn't reach the level of consciousness as the NBA suspending the rest of the season, or the NCAA saying we're going to have March Madness but without the madness in the arenas. And so all of a sudden people are really focusing on this. And so I'm speaking to you today. Everybody in the state of Louisiana has a role to play. And we need to come together as we always have and make sure that we are good neighbors. Do it for yourself, but be a good neighbor. Now, we are going to stay in close contact with local officials and with the healthcare community every single day about this particular event. At this point, obviously anybody behind me is available to answer questions, and we are going to take questions for a few minutes. And so, again, I want to thank everybody for being here, but much more important than that, thank you for the work that you're doing every single day, and all of the employees, all of the people that you work with who are on the front lines. Yes, sir.
Corona, have you yet been tested, and are you going to change your schedule? You were at Corona
Yeah.
today, there was 300 people on and on. Is this something that you're looking at considering?
Well, we are certainly looking and working with local officials, and as I mentioned, we're at an inflection point, and so we are looking at limiting certain things that we know to increase the risk of the virus being spread, it has to do with gatherings of a certain size. And by the way, nobody should wait for an event to be canceled. If you're one of the older citizens that we're talking about, if you have those chronic underlying conditions, you shouldn't be going out into a crowd, period. You should only get on an airplane if it's absolutely necessary, and under no circumstance should you get on a cruise. So don't wait for anybody to cancel an event before, if you're in those categories, that you take action for yourself. And you're going to hear more about events coming up soon. I know, for example, that the mayor-president of East Baton Rouge did just cancel the St. Patrick's Day parade, and you're going to see more about that. Consistent with the idea of what I just told you, I believe we're at an inflection point. I have not, and I want to get back to what the Surgeon General said a while ago. I don't have a symptom. I haven't come into contact with anybody that we know that has coronavirus, and so it makes absolutely no sense for me to get a test. And so I wouldn't want to do that, because while we have surged in our capacity for testing here in Louisiana, we don't have so much capacity that we can start testing people who don't meet any of the CDC guidelines, not at our public health lab, and you're going to see more testing, but they will always be consistent with guidelines that we're getting. And by the way, those guidelines will change as we learn more about the virus and as that capacity ramps up.
Can I jump in on that one, Governor? This is important because I do think there's some confusion out there, and the governor got the question about has he been tested. There have been several legislative leaders, and even the president's been asked that question. As the governor said, if you don't have symptoms, then it really doesn't make sense for you to get tested, and it can actually do harm, because if you don't have symptoms, then you might be at the beginning stages and that test won't test positive, and then you are falsely reassured. And we don't want anyone saying, oh, I got a negative test last week, I'm fine, I'm not going to worry about these symptoms now. We want people to talk to their healthcare providers. And folks often talk about the president saying anyone who wants a test can get a test. What he said was anyone who wants a test can get a test if their healthcare provider says that they need a test and puts in an order. And it's important that folks, when they're thinking about whether or not they should be tested, they think about symptoms, they call their healthcare provider. We don't want to utilize our limited resources testing people willy-nilly. We want to utilize our resources in a targeted manner to make sure people who are most at risk, people who are symptomatic, can get a test done quickly and can get their results back quickly. And again, at this point, if we go overboard on testing, we could give people a false sense of security and actually do more harm than good.
Yes, ma'am.
When it comes to the test, I know we said earlier in the week that it's at least 23. How does each test kit work? Is it one test kit can test hundreds of people?
Well, okay, I'm going to ask Dr. BU to come up, and he is our testing expert here, and we're calling on him a lot. But you make a great point. Every time we run a test, we're running a test for multiple individuals, and if we don't fill the tray up with individuals who have been identified as symptomatic and who need testing under the CDC guidelines, we will fill the rest of the tray up with surveillance samples so that we have a better idea in the general public at large, and specifically those with flu symptoms, how many people might be positive for coronavirus even though they've been recommended to be tested for the flu, and we have that sample. And that's because once we run the test on that tray, every well on that tray is no longer available for another test. And so we're maximizing the testing we're doing. So every tray that we run has both, many times they're going to have individuals who meet the CDC guidelines for coronavirus, but the rest of the tray is going to be filled with surveillance samples. And this is also an issue with the reagent that we use. And look, I'm not, this is not my specialty. So I'm going to ask Dr. BU to come up, and he can tell you more about that and about what our capacity is now, because we've recently received from CDC many more test kits. And so our capacity is ramping up, but not to the point where we're going to be able to test everyone who wants a test. Where you at? There you go.
Yeah, no, I'm pleased to say that the governor could also give a press conference every day on testing and be accurate. So what I'll say, and we emphasized this yesterday when asked about the number of kits, we are, just like with any other reagent, as we are starting to ramp up testing, we continue to order. I've been really pleased with how quickly the CDC has been able to deliver on those orders so far. We're definitely prioritizing testing for individuals with symptoms, and so far we don't foresee any problems there. So I can't give you a live number, but we have plenty of testing capacity for the people who need it.
Just for an understanding, so how does each kit work? Is it one kit, you can test hundreds, just for an understanding?
So right now, one kit can test hundreds, yes, and we have that capacity.
Yes, sir.
In New Orleans, Mayor Cantrell and Dr. Vigno, they've kind of been a little bit critical and they question the length of time for the presumptive tests to come back positive or negative. Do you share those concerns?
Well, I don't share the concerns, and I don't. First of all, I don't know if you're saying that they are concerned about how long it takes for us to test here at the public lab, or whether, or it's CDC's the length of time. I don't share the concern because not a single test done by any public health lab in the United States of America that was presumptively positive has been ruled negative by the CDC. So a presumptive positive is a positive, period. And so I don't think we need to worry about how long it might take for the CDC to confirm it as such. And that is not a use of our energy, our time that is helpful. We have a positive test when we have a presumptive positive here at our public lab.
Can I jump in on that one too, Governor? This is important for you all to help your viewers and your listeners and your readers understand. We live in a convenience culture where you can go into a minute clinic and get tested for strep throat and find out within a half an hour whether or not you have strep throat. It's important for people to know that is not the type of test that we have right now for coronavirus. It takes anywhere from 4 to 6 hours to run the test. That's just to run the test. We have limited places that can actually do the test, so you have to have the provider take a sample. Provider's got to see the patient, provider's got to make a decision, provider's got to get a sample. That sample then has to be transported to a lab in Louisiana, to the state public health lab. That can take a certain amount of time, usually several hours to a half a day, because they're doing pickups twice a day. Once it gets to the state lab, it then has to be run. And again, we want to wait sometimes to run those samples so that we don't use up all the wells in the test kit. So important for people to know that it takes typically across the country, not just in Louisiana, but across the country, 24 to 48 hours minimum to get those test results back, and sometimes longer if you have other delays in the process. And I don't know if you wanted to jump in and talk about the process here.
Yeah, and I would just note, so we do have a statewide courier that's bringing samples. Later today, with the governor's direction and support, we'll also be really increasing the capacity for New Orleans testing. But the CDC and the federal government also gave us assistance with recent guidance, allowing us to move from 2 swabs to 1 swab, so 2 samples that we're testing per patient to one sample. That expands our capacity again on that plate with limited wells. So we are, as I mentioned this morning, 84 hours into our first case of coronavirus in the state, and we have been on the hour, adapting, learning, and continuing to expand our capacity to meet the demand. We're going to continue to do that at the governor's direction.
Yes, sir. I'm sorry. No, go ahead, Stephanie.
So, while public health and safety is the #1 concern, the economy is like shriveling before our eyes. So what would you say to the businesses that are all of a sudden seeing their business dry up, with everybody so worried? What is best practices at this point for people to go about daily commerce, even as the large events are being canceled? What about restaurants and shops?
Yeah, so we should, and this is something that if you go to coronavirus.gov or where
Coronavirus.gov.
you're going to see this too, to the maximum extent possible, consistent with the guidance that CDC is putting out. People should go about their lives as normal, and so if you're sick, stay home from work. If you're not, go to work, and so forth. I think people should, consistent with the guidance that we're putting out and that's available from the CDC, engage in commercial activities and work as you normally would. And look, this is until we get through this. This is going to be hard on every aspect of Louisiana and the United States of America. I will predict today that certain difficulties will be manifested over the next several days and weeks that we can't even imagine right now. But doing everything we can in the short term to extend the duration of this out and lower the peak of the coronavirus infections is going to be good, not just for public health and safety, not just good for these providers behind me so that they can meet the demand. It's going to be good for business too. Although it's painful, and I fully understand that, but the sooner we can come out on the other side of this, the better off we're all going to be, and that includes the business community. That includes the national and state economy. You know, and you're right, that's not the highest priority, but it is extremely important for us that we do this. So I would just say engage in normal activities as you are able to do so, consistent with the CDC guidance. You know, but if you're older, if you have those chronic underlying health conditions, you are most vulnerable, and you need to be making sure you're extremely careful. Yes, sir, Sam.
Governor, what's your message to the people who may in fact show a symptom or two or may have reason to believe they came into contact with someone with coronavirus but still don't rise to the level that they meet the CDC guidelines? They're worried they may have the virus, but they aren't allowed to get it.
Well, my message to them is always contact their healthcare provider and let them know exactly what their situation is, whether they've traveled, whether they've come into contact with someone. I will tell you, it's my understanding under the current CDC guidelines, if they are symptomatic, because your question said that they have a symptom or two and may have come into contact, they're going to qualify for a test. Especially if they are negative for the flu, which I think is an important part of that too. But you have to have those conversations with the healthcare providers. I would encourage you to call in if you are able to do that, so that you don't physically transport yourself if it's not necessary, because we're trying to reduce the demand on our healthcare providers. But having that conversation with your doctor is essential. Yes, ma'am.
I have a two-part question. So I know there's a lot of rumors going around. I had a viewer reach out to me saying that he has a child in one of the schools and a kid was brought out of the school saying that they had corona. Is there any cases with children or high school? And then my second part question to that is there anything in place if there is, say, a student in any of the high schools that gets it?
Yeah. Okay, so I'm glad you asked the question. When we have positive cases, presumptively positive cases, we are telling you, and we're telling you immediately, and we're telling you factually. If you hear it somewhere else, it is not real. And we do a great disservice when individuals are out there spreading false things. Because it consumes time and attention and potentially resources that we don't have available for those things. And so, to my knowledge, we do not have a school-age kid anywhere in Louisiana with a presumptive positive test result.
That's correct.
That is correct. Now, getting back to what the Surgeon General talked about, because this is particularly important. A while ago, I talked about the duty that we owe as brothers and sisters, as Louisianans, to people who are in the heightened category for vulnerability. If we have school closures, they have to be very, very coordinated, because all of a sudden you're going to have grandparents who are in that category taking care of grandkids who may be asymptomatic or mildly symptomatic, who are introducing the coronavirus that we're worried about to the population that we're worried about. And so not everything that you think might be helpful will actually be helpful. And so these are all hard decisions that have to be made, and we cannot make them in isolation so that they're being made without full discussion in collaboration among all of the governmental leaders and the public health officials. Yes, sir.
From a federal perspective, the president's made a number of statements, false, misleading, confusing. What are you doing from a federal level to make sure the public can trust the messaging and
Well, my messaging has been 100% consistent, and it is that our relationship with our federal officials, whether it's Vice President Pence, the CDC, the Surgeon General, Dr. Brett Giroir, our working relationship has been very good. And the guidance that they have given us thus far, the resources that they have made available to us, not just on testing capacity, but in terms of information, in terms of epidemiological assistance and so forth, it has really been quite good. And so I'm not going to engage in any discussion trying to cast blame or to even try to validate the premise of the question. That is not helpful to us right now in Louisiana. You know, I told you all during the campaign that we recently concluded that there was a time for politics and campaigning, and there's a time for governing. This is, if there was ever a time for governing, it's right now. Yes, sir. Right here.
Two parts. One thing I wanted to tell you, while you were talking about events being canceled and things like that, so the SEC did cancel the tournaments. So you might not have known that because you were just talking.
The what?
The SEC.
What and what happened?
They canceled the tournament. March Madness.
Okay.
My question for you is that you pointed at it, what social media, you know, we hear a lot of us have social media accounts or whatever, but a lot of people on social media, particularly younger people who aren't the age group who is the biggest concern, but a lot of younger people are taking advantage of lower airline prices to go on trips and things like that. What do you say to them, and also Surgeon General, you could take this question to you, what do you say to them about doing this and, I guess in a way, trying to take advantage of the market?
I'm going to ask the Surgeon General to respond to the question because I think that based on the way the question was asked, we're at risk of not communicating well when it comes to younger people. It isn't that we don't have concern about younger people. The good news with the virus is that they are least affected. Some of them will remain asymptomatic even if they are infected. Others will have mild symptoms perhaps. And so when we say we're not worried about them, it is limited to that only. We are very worried that they have the virus and they're going to spread it, especially they're going to spread it to people who are most vulnerable. And so there's two sides to that coin, and I don't want people minimizing the seriousness of this situation because 80% of the people who get the virus are either going to be asymptomatic, mildly symptomatic, won't require any medical attention because they still carry the virus. And this is how we are going to lower the peak and expand the duration. So we do need their assistance as well. As it relates to their activities, and you mentioned flying, I'm going to ask the Surgeon General to share his remarks on that.
Well, I think that's a great question, and just so you know, every single day we're looking at where coronavirus cases are popping up around the world so that the American people can know the places that are at highest risk and the places that are at lowest risk. One place that young people shouldn't be traveling to, and no American should be traveling to right now, are the countries in Europe where we just instituted the travel restrictions because we know that that is the new China in terms of being the epicenter of cases. To answer your question, I would go back to my 3 points. Number one, know your risk. And part of knowing your risk is knowing the community that you are going to. Number two, know your circumstances. Again, if you're going to travel, am I traveling to a place where there's no coronavirus cases? Am I traveling to a place where there's clusters, where there's lots of coronavirus cases? Number three, know how to protect yourself and your community. If you're going to go to a place where there's coronavirus cases or going anywhere, wash your hands frequently. Making sure you're staying away, keeping your distance from people who are sick. And if you have a loved one in your life, and this is the most important thing I want people to take out of today. Over 60, with chronic medical conditions are the people who are going to disproportionately die from this illness. If you're a young person and you're traveling period, but especially if you're traveling to a place where you know there's coronavirus spread going on, don't come home and then go visit grandma in the nursing home. Don't come home and go hang out around grandpa at Easter dinner and tell him all about the great trip that you just had to Europe. Quarantine yourself from those people for 14 days so that you aren't bringing that infection back to your loved one, because that trip is not going to be worth it. If you look back at it and think, well, that was a great trip that I had to France, real cheap, came back home and grandma passed away afterwards because I gave her coronavirus. Know your risk, know your circumstances, know how to protect yourself and your families.
And with that, he just mentioned something. I'll just tell you, for the next 30 days, there will be restrictions on visitation to nursing homes, to prisons and jails. We have older inmates there, but all of the inmates live in close proximity to one another, and certainly we have limited medical capability at our prisons. And so we will be announcing these things. And I hope that the people who are out there who are inconvenienced and unable to visit a loved one will understand we're doing this for the protection of their loved one. And it will be for a 30-day period. Well, the announcement's will be made soon. But as for prisons and jails, yes. As for nursing homes, yes. And we're still working through some of this. And the guidance is going to come out very, very quickly. But while we're talking to the public out there, and I'm looking at all these cameras, I'm asking people to understand that what we are doing is for the benefit of your loved one, the one that you are most concerned about, and take the opportunity to call them. Take the opportunity to Skype with them. That sort of thing. But we are going to be limiting visitation to at-risk populations, because these are the sorts of things you have to do if you're going to lower the peak and extend the duration of this event. Yes, ma'am.
In terms of universities, obviously we've seen some universities starting to move to online classes.
Yeah.
Are you now recommending that to universities, or are you still leaving it to them to decide? What kind of guidance are you giving?
Well, so the situation is not uniform across the state of Louisiana geographically, and so forth. We are having conversations with the higher ed community. Obviously, in the area where we've identified a cluster in community spread, they have already been asked to do this if they are able, and they are, in fact, making this available. And it's not immediately available, but at some point, we know that certain institutions of higher education are going to transition to distance learning. Some don't have the capabilities to do that, and so we're working through these things at present. But as we have more information to give you, we certainly will. A couple of more questions. Yes, sir.
Dr. Adams, you said that this isn't our first rodeo, but the level of the closures and cancellations seems to be unprecedented. It leads to an unprecedented level of fear. What do you say to people who are standing in line right now with baskets full of toilet paper? Do you think the hysteria is overblown? What is your message?
Well, I do think that panic and fear have the potential to harm more people than the coronavirus actually will at the end of the day. It's important for people to know, when you hoard, when you overreact, when you stigmatize people, and we're hearing some horrific stories about people being stigmatized and discriminated against because they come from Asian countries, that can hurt more people than the coronavirus. So we're trying to thread the needle here, and the governor and I talked a lot about this morning. We don't want anyone to think we're minimizing the significance of this public health threat, but we want people to keep it in the context. We know who is most at risk. That is who we need to really focus in like a laser beam on protecting. We know that apart from that group, the lion's share of folks, 98 to 99% of people, are going to recover if they get the coronavirus. 80% of people aren't going to need medical attention. So it's spreading the facts so that it overcomes the fear. And again, to the question the gentleman brought up earlier, I would implore the media, please, now is not the time to politicize situations. Now's the time to spread facts. Go to coronavirus.gov if you have any questions. There's not a question I've been asked by the media in the last 2 weeks that isn't on coronavirus.gov. get the facts. That's how we help people get through this difficult situation, help them put it into context.
Okay, last question. I got multiple hands up. I'm going to go back here.
For those people who've been told to self-quarantine, if they don't live alone, how should they or their loved ones protect themselves?
Okay, I'm going to obviously ask somebody behind me whether it's Dr. BU or the Surgeon General. And first of all, Dr. BU, talk about the category of people that may be asked of, and then how they can go about doing that.
Self-quarantine, initially we were doing, especially for people returning from those level 3 countries, now level 3, level 2 countries, that list on the CDC website. And now with community spread, certainly in New Orleans, we're hearing about healthcare workers who also had come into close contact with individuals and now need to be at home self-quarantine. So what that means is if they're living in a house with other individuals, they need to be essentially isolating themselves. So, in a room, meals can certainly be delivered to that door, but not, really getting into very close contact with the family. There's even cases where families are going to stay in a hotel and letting that individual be alone in the house. So we give guidance to make sure that people are taking precautions to keep people safe. That individual is self-monitoring, so they are checking their temperature twice a day, looking for symptoms of cough, of shortness of breath. One of the important things that I want to say, though, is those contacts of contacts, those individuals who are living in the household, if they themselves are taking those measures, if their loved one is taking that measure and nobody's symptomatic, we're not advising that those people also not engage with daily life. We know that there may be, families where the partner needs to be going out there and going to work. And it's important for workplaces to understand that as well. If we're doing everything we need to in that home, that other individual, those children that need to go to school, they can continue to do that as long as they're taking the steps that we advise. I don't know if you want to add to that.
I would just add to that very quickly. One of the things the President announced last night is that we're going to be leaning into economic measures, like a payroll tax holiday, like loans for small businesses, to try to give people a little bit of financial resiliency to deal with some tough situations that may come up, like having to stay off from work, like having to self-quarantine. And here in Louisiana, no one knows it better. You have hurricane season. During hurricane season, we tell people, have a plan, prepare. Think about what you need in your home. Think about what you would do if something occurred that caused you to be displaced or to have your life disrupted. We need businesses, schools, we need churches, and we need individuals and families to think about right now, what would I do if we had a case of coronavirus in my community, in my home? Start thinking about that plan. And again, on a federal and on a state level, we are leaning into, and the parish presidents talked about this earlier, making sure we don't have any unintended consequences, that we're thinking about those supports we need to provide for people so that they can do the right thing to protect themselves and their communities.
So I want to thank the Surgeon General again for coming to visit with us today. It has been, I think, hugely beneficial for us. I think he said it was beneficial for him as well, and it's going to help us to better prepare to meet the demands that we're going to see. And look, we're going to get through this. It's going to be difficult. It's going to take some time. But the level of difficulty and the amount of time that we're going to deal with this is dependent upon what every person in our state does. We all have a role to play. Let's play that role. Let's cooperate. Let's get through this, and I'm sure that we will. I always ask people to do everything that they can consistent with CDC guidance, consistent with the science that we know, and as our scientific knowledge evolves, I also ask people to pray. So I'm asking people to pray for this particular situation as well. So God bless you and thank you so much.
And we need to get one more visual for him because we've been touching the podium, Governor. Make sure you all get this. Practice what we preach.
Thank you. And there you go. And that was U.S. Surgeon General Vice Admiral Jerome Adams, Governor John Bel Edwards there speaking after their meeting this morning to discuss the current situation of the coronavirus here in Louisiana.
Yeah, there was a lot to unpack from that news conference, really reassuring the public among a lot of fears that have been out there, kind of separating fact from fiction, saying that about 80% of people who contract the virus, and we know now that there are 14 cases across the state of Louisiana, will not need to seek medical attention. So that was one of the big headlines from that news conference. But again, saying that even though Louisiana is doing pretty well well in preventing the spread of this disease, and that is an effort that's going to take some time. It is important on all of us to really be good neighbors to everyone and make sure that we are doing our part not to make the situation go any further. There are a number of headlines that we are gathering throughout the morning this morning, including something else that a lot of people are talking about, the St. Patrick's Day parade here in Baton Rouge. We have confirmed that the Wearing of the Green parade has officially been postponed at the request of the city of Baton Rouge. We are expecting to hear from Mayor President Sharon Westenbroom within this afternoon also about canceling citywide events.
And beyond that, something else that came into our newsroom just moments ago, the Southeastern Conference has canceled the men's basketball tournament. So the Division I tournament that was playing in Nashville is no longer taking place as of today. It will not run through this weekend. We're scheduled to play the LSU, that is, was going to play in the quarterfinals of the tournament this weekend.
We will continue to bring you the very latest updates on the coronavirus situation and its impact on not only the world, but here locally as well on our social media platforms and brproud.com, as well as our BR Proud app. We have crews right now spanned across the capital city and in that news conference with Governor John Bell Edwards and the Surgeon General. They're working on their stories. Again, you can head to our website, brproud.com. Continuing coverage under the coronavirus tab there on their website, and we'll see you right back here tonight for Fox 44 News at 5:30 and NBC Local 33 News at 5 o'clock. Until then, we'll send you back now to regular programming.